Da, da, da. Okay. So anyway, I'm gonna get this thing recorded. I don't know if anybody's gonna care to see it or anything. Um, yeah. So recently, in case anyone's interested, our channel ended up getting monetized, and I was like, oh, okay, didn't okay, whatever. Because apparently, like ads had been running on it for a while, but we weren't getting anything from it, no revenue or anything. And so we decided, okay, now that it's monetized, what we're going to do with that, any funds or anything that come to us from that or from subscribers or whatever you call it, memberships or anyway, I don't know how this whole thing works. I feel so old. Anyway, so if we get any type of funding or whatever from the monetization of this YouTube channel, we're going to put it towards our patient assistance fund. And that's going to go directly to the patients here, in the States, United States, for those who are international, of course, we have people from all over the world who watch our videos. It's wild to me, being just here in Mississippi and having that happen. But anyway, so if we happen to get any funding from this, it's going to go towards the care of our patients who are struggling, which is quite numerous. So anyway, I was trying this out. It occurred to me the other day that maybe there would be some interest in just the daily routine of what I go through. This morning I got a fax of about 5 different patients' lab results, and I'm just going to kind of open them up. I'm going to read them as I'm looking at them and tell you what I think about them, what my recommendations to the patient is going to be. I'll comment on what type of medication they're taking and whatever, and just going to go from there. I consider this kind of routine and or boring, but for folks that don't really see this kind of stuff all the time or hear about it, I thought it might be kind of interesting to see to see the boring life of what I do day in and day out. Anyway, and of course, right whenever I start this is when I have to sneeze and my nose is itching. So sorry. Anywho, so let's see. Let me figure all this out here so that I get it all pulled up correctly. And of course, I don't know, all the big YouTube people always say like and subscribe or whatever. It helps the reach of the channel. I guess I'm going to have to learn about all that. But anyway, because I don't know, wouldn't it be neat if we could get enough subscribers and or members or whatever to help support even part of the clinic's patients? Like that would be amaze balls. Like, okay, so yeah, if you see a commercial pop up or whatever, an ad, I apologize, but they were going to put them on our channel anyway, so we may as well make money off of it and and then be able to help our patients out. So anywho, okay. So with my itchy nose, I'm going to go ahead and get over here and pull up some labs. And let me move those over. Make them to where I can kind of see them. And I'm going to have to pull up the patient's chart as well so that I can see what's going on there. All right, let's see. Boop. As I said, it may be a little bit boring, but hey, so let's see. So first up, let's see, we've got a 37-year-old who was assigned male at birth, and their labs here, let's see what they show. So our general labs that we get are going to be a complete blood count, comprehensive metabolic panel, which, none of those have like hormones in them or anything. They're going to be the ones that check your blood counts, like your red cells, your white cells, platelets, things like that. And then the metabolic panel is going to check your liver function, kidney function, your electrolytes, those kind of things. So important stuff. Perhaps not the interesting part to those who watch this later. But anyway, so let's see right now for this 37-year-old who's on feminizing therapy. White blood cell count is a little bit on the high side at 12.7, but this is something that can be caused by many things. Like 12.7 is not noticeable really on here. It doesn't really catch my attention other than I'm mentioning it because people might want to hear about this stuff. I don't know. Uh, but anywho, so 12.7 white blood cell count. Maybe they were super stressed. Maybe they were super dehydrated. Maybe they had just worked out and then got their labs drawn. Maybe they were recovering from an illness. Maybe they were exposed to someone else who was sick. You know, there's many things that can cause this kind of a low level elevation of white cell count. And I'll look on their previous labs right quick and yep. So previously, their white cell count has been normal. So this is nothing that I'm concerned about, even in the least. I may mention it to them whenever I send them their readout of this. You know, I usually text my patients and say, hey, here, you know, I attached some labs and I'm sending it through a secure portal. Of course, I'm not texting them on the phone, but anyway, I'll send them a message that says, hey, you know, white cell count was this, but this could be explained by many things such as and list that out. Let's see. Otherwise, nothing really notable on the blood count. Looks like they were maybe mildly dehydrated, perhaps whenever they got these labs, whenever I'm looking at the metabolic panel. Uh, you know, it just nothing really notable on here. And I mean, most people are going to be slightly dehydrated whenever they get labs because a lot of time they end up fasting or they haven't eaten or drank anything, you know. I don't generally require fasting for labs, but a lot of people do it reflexively because everybody requires it. Anyway, so let's see, moving on. So keep in mind, you know, this is a trans feminine individual. They're on estrogen therapy, and currently they are on, pull up their medicine list. So right now, this person, remember, 37-year-old, assigned male at birth, on estradiol therapy. They've been on estradiol therapy for a couple of years now. So this is not going to be a new patient. They are on 2 milligram tablets. They take a total of 5 tablets a day, taking 2 tablets in the morning and then 1 at midday and 1 at night. And that comprises the total of 5 tablets that they're taking a day. I generally have people have their labs drawn somewhere between 6 to 12 hours after they've taken a tablet, if that's what they're on medication wise. And so looking at this, looks like they probably got their labs drawn a little bit closer to the time that they took the pill. So their estradiol level is 295, and that's of pgml for anyone who's international, you know, who may not have the same units of measurement. You convert it later. I don't know. I don't keep it on the top of my head. But anyway, so they have a 295 estradiol level, pgml, and their testosterone is 25 ngdl. So 295 and 25, I'd consider that a win. Being that it's estradiol is 295, I'd say they probably got this drawn closer to about 4 to 6 hours after they took a pill, perhaps. And so, you know, they're getting great testosterone suppression from this. You know, we aim usually for perhaps less than 60 on testosterone level, 60 NGDL to clarify. But you know, we like to see it, you know, at least 10, preferably maybe 20 or so. Sometimes that's very difficult to do, though, to really get people to have a specific testosterone level when you're suppressing testosterone, you know. So 295 on estradiol, 25 on testosterone. I consider this a pretty solid win, and their labs have been pretty consistent, looking about like this in the past. So this 37-year-old assigned male at birth, transgender feminine person, on 2 milligram tabs, total of 5 tabs a day, with a 295 estradiol level and a 25 testosterone level. That's a solid win. I'm going to go ahead and close their chart out and pull up someone else and see what's going on here. Let's see, what have we got? This person, this is brand new person. They haven't even started on hormone therapy yet. So not much to see hormone wise on them. We just got the blood count and metabolic panel on them, which looks perfectly fine. But we'll close out their chart because they don't really have any hormone stuff to comment on. Let's try someone else. Let's open this one up. This one. Ah, there we go. Okay, so good deal. Let's move along. This is going to be 31-year-old trans male, I believe. Hold on. Let me pull up their chart. Da, 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 da. So, yes, so we got a trans male, 31-year-old, and currently they're on testosterone gel. So with testosterone gel, depending on the kind that you have, you may apply it in different ways. This one comes in a pump bottle. You apply 2 pumps for the standard, full transition dose. Kind of depends though, different people absorb this different ways. So kind of unpredictable. So with this person, we looked at their blood counts. Blood counts look fine. Sometimes we look at the hematocrit count, especially if someone is on injectable testosterone because it can increase your red blood cell count. But that looks fine as well, and they're on gel, which doesn't typically cause that problem. Their testosterone level is 145, so 145 NGDL, again, with the levels in case we got an international person watching this later. And with a 145 testosterone level, I'm going to need to message them and ask them, what timing did they have their labs drawn at? Because this is a little bit on the low side for if it was drawn during the time that I normally tell people, which is somewhere between 6 to 10 hours after they apply their gel. But then sometimes people can't do that and they end up having it drawn, 16, 20 hours later, the next day. So I'm going to need to know from them when they had their gel applied. I would typically maybe be looking for somewhere between 300 to 600 or so during the time frame that I'm looking at them to have drawn. But a lot of times, like I said, that can vary. Different people absorb topical testosterone differently. So, okay, and then their estradiol level is 49, which with trans men, if they have ovaries and everything still, they can have kind of an up and down with their estradiol level. So we're not generally worried exactly about estradiol levels in the trans male population, but I do keep an eye on them just to see, are they still kind of having this cycling of up and down estradiol over time whenever I get labs. So anyway, so this trans masculine person, I'm going to have to message them later and see when they had that gel applied before their labs, because 145 of testosterone is a little bit low. Let's see. Let me pull up my next person, see what's going on with them. This may be a new person too. Oh, yep. Brand new person, excited to get started, but no hormone labs on this. So just the blood count and metabolic panel. So I'll skip to the next person. Oh yeah, I know this is a person that's been here for a hot minute. So this is going to be a transgender female person. Let me go pull up their chart so that I have their information to tell you. So this person is 24-year-old, assigned male at birth, transgender female. And what I've got them on currently is estradiol valerate injections. They're injecting right now 0.3 milliliters weekly, which equates to about 6 milligrams weekly that they're injecting. They also happen to be on progesterone capsules, one at night, 100 milligrams. So in regards to this person's labs, knowing that they are on 6 milligrams weekly, and typically I tell people to have their labs drawn on estradiol injections somewhere between 5 to 7 days after their shot was given. And this person looks like they hit it dead on. This is perfect. 256 estradiol level. That's PGML for the units of measurement. And then their testosterone is 23 NGDL. So I will consider that a pretty solid win. 256 estradiol level drawn 5 to 7 days after you've given yourself the injection. That's pretty solid. That's right where I'm shooting for, which typically I'm looking for maybe like 150 to 300. Just it really depends on the person too, because sometimes people are, they could be older and they have different comorbidities. Maybe they've had a history of cancer in the past. Maybe they've had cardiovascular events and things, and they want to mitigate their risk, and so they want to aim for a little bit on the lower side. Perfectly fine. This is part of what we discussed during our visits, just to make sure that we have their goals in mind and what risks they are comfortable with taking. So, like I said, this person, 24-year-old trans feminine person on estradiol valerate injections, looking great with a 256 estradiol level and a 23 testosterone level. I'll take it. Like I said, testosterone levels I'm looking for in those looking for full transition anyway, somewhere between, say, 10 to 60. Really and truly is probably going to make them feel better to have more like 20 or so. Testosterone is important. We don't want to get rid of all of it. I know some people kind of freak out whenever I say, your testosterone's too low. But testosterone wise, it does help with your metabolism. It helps with your brain health, prevent brain fog. It helps with bone health as well. So we do need a little bit of both, no matter if we're transmasculine or transfeminine. So let's see, let me close this person's chart here and see if I can pull up at least one other person here. We've got to have somebody. Oh, I won't start singing to y'all. Y'all leave really quick. Oh my God. So let's see. Here we go. Open up their labs. Here we are. Ugh. I hate whenever they send labs over and it's in a very difficult to read form. Like the lab facility itself, sometimes they don't have any control over it, what their readout is going to be, but golly, it makes it so difficult to read sometimes. But that's okay. I can get these. So this is going to be another trans feminine person. They are, where'd it go? Another 24-year-old. Okay. Wow. We got everybody in their 20s today. So 24-year-old assigned male at birth, trans feminine person. And this person is also on estradiol valerate. Same dose as the other person, 0.3 milliliters weekly of the 20 milligram per ml concentration, if anyone's wondering. And that equates to about 6 milligrams per week. This is a pretty standard dose for anybody who's wondering. 6 milligrams a week of estradiol valerate is pretty standard. Usually I put people on that. And the vast majority of folks hit their levels perfect right there. Every now and again, they'll need a little bit more, a little bit less. But anyway, so this person is on 6 milligrams weekly of estradiol valerate, and their estradiol level is 202, so 202, and that's PGML for our international people with units of measurement here. And testosterone is 33 NGDL. So I consider this one a win as well. 202 estradiol level. Like I said, I'm shooting for between 5 to 7 days after someone does their injection. I'm shooting for somewhere between maybe 150 to 300, again, depending on the person's goals, their overall health, things like that. But for this person being young and nothing's listed in their chart, they don't really have like a huge medical history or any, major risk factors, perfectly fine then, in my opinion, for them to be on the, a nice regular dose. And a 202 is right smack in the middle of what I expect for their estradiol level. And then their testosterone is well suppressed into the 30s. Looks like on their blood counts and liver and kidney panel, looking pretty normal as well. So, okie dokie. Well then, I'm going to close this little thing out and have it posted in our videos and see if anyone's actually interested in this stuff. And I'm going to message that one patient so that I can find out when they applied their testosterone dose. So I hope that this was, reasonably educational for folks. I didn't announce it. It's kind of just sudden, but I want to find, what kind of content is kind of interesting to folks and everything. I consider reading labs to be fairly boring, but it can be an educational and learning opportunity for a lot of folks that, like I said, they don't get a lot of interaction maybe with their healthcare provider, or their healthcare provider just says, oh, your labs are fine, but doesn't really tell them anything about the labs or anything, which is sad. We need to have better conversations with our healthcare providers. So hopefully, if I do things like this live stream and I read off people's labs and what medicines they're on, and what I'm looking for, hopefully that'll kind of help people narrow down maybe some questions that they might have for their own healthcare provider. But anyway, so I will see if this, when I post this, if this gets enough views that it shows that okay, there might be some interest in watching this kind of content, then I'll do more live streams of it, just so that people can kind of get a feel for what we're doing behind the scenes here in regards to how we actually treat folks and prescribe and everything. So, anywho, like I said, we recently found out that our channel got monetized. We will be using any funds that are made from this channel to help our patients. It'll go to our patient assistance fund. So if you're on watching our videos and a commercial or ad comes on, feel free to skip it, of course, but also it really helps, I think, or at least people tell me, if you watch the ad for a little bit more than when you can just skip it. And or if anybody feels like helping, even at like a $1 a month membership for the channel, all that's going to go 100% towards our patient assistance fund. So love y'all out there. I'm going to go ahead and sign off and get this posted onto the channel so that I can kind of watch over the next few days and see if anybody even is interested in this. So anywho, y'all have a wonderful, fabulous day, and I will hopefully see you later. All right.